Hey everyone, welcome to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I am joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
Emphasis on reconstructive.
This time, because we are on trauma call.
And anyone listening is also on trauma call with us right
That's
now.
right. We're all on trauma. It's a group effort. Trauma call is a group effort.
Sorry to anyone listening.
Yeah.
It's not fun.
No, but I think this is a great one to just jump right in, and I'm going to start because I need to move your appointment. Dr. Martin has been called away to the ER on an emergency. I'm not sure when he's going to be back.
And the common response is, what Botox emergency does Dr. Martin have in the ER?
Oh no, it's right.
Yeah.
A Botox emergency. To which I followed up with, no, Dr. Martin takes facial trauma calls, so it's usually something quite urgent. It's a facial trauma. It's legitimate. So if you ever get that call from me or Chandra or whoever is at the front desk, just know that it's real and we really are on trauma call.
And I'm insane enough to take trauma call.
Right. So why does a plastic surgeon take trauma call?
And that's a really good point. And why does a plastic surgeon take trauma call that also has a very successful cosmetic surgery practice? Can you answer that, Amy?
Because you are a glutton for punishment.
Right.
Because you like helping people.
I like helping people. And secondly, I'm good at facial surgery. Third, I was trained to do it. And it's something that I'm passionate about. The hidden secret for plastic surgeons is a lot of us do aid work or mission work. Mm-hmm. So medical missions with cleft lip and palates. And I love that. I've done that in Guatemala. But this is in some ways my desire to give back and also my desire to continue to improve. So for me personally, in my practice, I don't take tons of trauma call, but I do it intermittently.
Once a quarter. Comes up faster than you might think.
To keep my skills up and to keep improving. And these are the most challenging cases that you could ever have. And hopefully we'll go through some of the stories today. Unbelievable devastation of the face and neck, and we have to fix it. They call us. They're like, okay, you're the guy or you're the lady. Go do it. And when you're faced with that, 3 a.m, it can be overwhelming, but it's also exhilarating.
Yeah, and I think that's the different. What people might think. A plastic surgeon taking trauma call is like people who maybe have a ruptured implant.
I just want to make it real clear. Facial trauma call. I don't take full trauma call.
Correct.
Right?
It's facial trauma, and that's the big.
So I'm super specialized. So when they call, they're like, "Oh, I'm like, that's not my problem.
That's not me. Call the neurosurgeon.
Yeah.
Call
Is
someone
their face
else.
ripped off? Because that's what I fix.
Yeah.
I don't fix the other stuff.
Yeah.
So.
No, that's true. I mean, when the call service calls here, I always kind of. Take it first and
Get the
ask
411.
them, yeah, like what is this? Like make sure it's even something that is related to us. And all right, fine, you've passed. If someone has lost a tooth, don't call me.
Right.
If you have a frontal bone fracture, call neuro.
Yeah.
So it's legitimate and it's a good reason. So I think to me the biggest difference between what you do as a plastic surgeon and what you do as a trauma surgeon essentially is that you're likely treating patients in the ER.
Right. So first and foremost, I just want to reiterate that it's a plastic surgeon that works in cosmetic surgery and a plastic surgeon that works in trauma surgery use the same techniques. So don't think that just because I do face and neck lifts every week doesn't mean that doing some of the surgeries in trauma isn't very similar. It really is.
Right. You got to put Humpty Dumpty back together.
Right.
One way or the other.
And actually, I would argue that the cosmetic surgeon that helps with facial trauma is better at facial trauma in some ways than the person that does facial trauma all the time, because the cosmetic surgeon knows other techniques or is facile, well versed in other techniques that you can do different types of procedures.
Yeah, I'd say those are more at the forefront.
Yeah.
You're kind of always concerned with optimizing scarring, making sure that things are aesthetically as good as they can be. I think a good example of that is we get a lot of calls for dog bites or bike accidents. It used to be when you were on trauma call and there'd be a bike accident, we'd all want to know if it was a road biker or mountain bike, because I'm a road biker and there was an avid mountain biker in the office. So we'd have this kind of, competition going, being like which one is safer and or which one is more dangerous.
Actually, I'll tell you, I actually think road biking is more dangerous.
Well, I think they're worse when it happens. I think, though, the frequency of mountain bike accidents is higher.
Because you definitely break a wrist or break a leg.
Right.
Yeah.
They tend not to have the wicked road rash that someone who crashes their bike going 40 miles an hour on a road has. Yeah. So.
What was the one we had? The bee got stuck in her helmet.
Yeah.
And she was going like 40 miles an hour.
Yeah, and
Wow.
I was stung by a wasp on my bike one day, and it is very distracting to be stung by a bee while you're trying to ride your bike.
Yeah.
Especially when you're going faster, you're being in pain while you're trying to do something technical is not easy. But my point being, like when these things happen, like a lot of times they do cross like parts of the mouth and lip, and regular ER doctor is going to suture that up just fine, but they're not going to necessarily maybe care that your vermilion border is absolutely lined up and perfect.
What's the vermilion border in Mrs. Medical Words?
It's where you would put lip liner, like where your lip meets the rest of your face.
The red part of your lip, so
Yeah.
it lines up. If that's off, even a millimeter,
It
looks
makes your
terrible.
smile look wonky.
Not all facial injuries have to be repaired by a plastic surgeon, but it sure is nice. And the ones that are more complex, 100% you should demand, if possible, the facial trauma surgeon who's a plastic surgeon, OMF or ENT surgeon. So
Yeah.
sometimes oculoplastics.
Absolutely. But Dr. Martin, what is it like when you, obviously it's a little different. When you go in for cosmetic surgery, your patient's in the pre-op bay, the nurses have gotten them all
This is
checked
how you draw
in.
the crowd in, because like there's that show Live PD. You're like, what's it like in
Right.
the ER? What's the real story?
But truthfully, like when you show up,
Oh,
I mean,
it is crazy. So we cover level 1 trauma centers, which are in Denver, which is a moderately large metropolitan area.
well, one of
an
the
urban,
largest in the region, too.
yeah, urban city, urban area, and man, it is chaos. When you go in there and it's not chaos, it's kind of eerie because then you feel like the hurt's coming, right? So you go in there, there's tons of people, tons of energy. Most of these people that go to these level 1 trauma centers are really sick, either very sick or traumatized, and it's very chaotic, but it's a controlled chaos, number one. Secondly, it's pretty admirable and amazing to watch these people at work in these super busy ERs.
Mm-hmm.
They're running around like ants, but they all have things to do. They all are kind of making sure that they're caring for the patients and the patients are taken care of. So yeah, it's total chaos. And so you come in and say it's like the middle of the night, which is not usual for the subspecialists. For us, usually the injuries, we don't have to go in right away. They have to stabilize the patient. The trauma service has to see them. But every now and then, if it's bad, they'll have us come in, and you'll go in there and you'll just, where's the patient? And you go in and it's never a good sight. I've had gunshot wounds to the face. You walk in and see the patient. I've had a woman, and we'll talk about some of these stories, who half her face got ripped off, and I had to go literally look and talk to her. She was awake. Severe motor vehicle collisions or car wrecks, and you're going into a scene that's very traumatic visually.
Yeah. Well, and
So, but I don't want to interrupt, but that part of it is where you have to be a little bit strong and coarse and go in there and take care of business, as opposed to trying to process what you're looking at right this moment. Because the devastation you see in these people is pretty bad. Mm-hmm. In most cases, if they're calling people like us in, it's bad.
usually,
Yeah.
or it's at insistence of someone who just wants a plastic surgeon to do something.
Right. And FYI, the people listening to this, if you are like, oh, God, thank God, Dr. Martin, I'm in Denver. If I ever hurt myself, he's going to sew me up. It doesn't work that way. Because you go into a level 1 trauma center and you have like a little laceration, and you're like, I want Dr. Martin to sew you up. And they're like, no, we're going to sew you up.
This intern's going to sew you
Yeah,
up.
because you don't meet the criteria to call in this guy or lady who is our last hope for the worst cases. So they're smart. They're holding out so we don't overdo it. They're not going to take their best fighter and put him out to the lowest level fight. They're going to put him on the biggest fight, the biggest stage.
Yeah.
Is that a good analogy?
I think that's good.
All
Yeah.
right.
I look at
Nils
it.
agrees.
Nils agrees. One of the things I think has got to be something that always weighs on your mind when you go into these cases is that you don't know this patient. Like our cosmetic patients, obviously, we know them extremely well. We know their
Right.
health history.
And I like that. So I think that there's some surgeons that really struggle with that. I like the unknown. I like the exhilaration and the concern. And
Is this patient on blood thinners? Let's see.
Yeah. A lot of times you're seeing these patients, they don't talk. They've been severely traumatized. Their heads hurt, so they're not talking. They're
Or
asleep.
they have a massively broken jaw and can't talk.
Yeah, they're intubated. That means they have a tube to help them breathe. I've had many who are severely inebriated to the point that they cannot speak. And the words that come out aren't English or any other language I've ever heard. Or I've had people that were so traumatized that emotionally they couldn't speak. They just had a hard time answering questions, which was really devastating to see, to be honest with you. So, but it's kind of exhilarating. You go in there and you're like, I'm not really sure how to deal with this. So what we usually do is do a whole workup. And a lot of times before I get there, the workup will be done, like a CAT scan. Things are probably expensive to order, but you need to do it and to see what's going on with the facial bones and everything else. It's very difficult clinical exam sometimes to judge what's going on because the patient's faces and necks are so swollen from the injury. If you consider a gunshot wound to the face, usually self-inflicted, it causes such a massive amount of destruction and swelling that it's very difficult from the clinical exam to know what happened. Someone who self-inflicts a gunshot wound to the face, rarely are they awake. It usually affects the brain in some ways, so the neurosurgery is involved and gets very complex. So you really rely on that CAT scan or even an MRI to kind of tell you what's going on. Usually that's ordered. So I'll go in and evaluate the patient, kind of see what we're dealing with. If they're very inebriated, I try to delay surgery till they can wake up enough to at least talk to me or consent. And then look at the CAT scan, talk to the ER doctor, and then talk to the trauma service. That's usually how it goes.
Yeah. And a lot of times, like you mentioned that there are other specialties involved in a lot of these really complex traumas. They might have orthopedic injuries, like a lot of other things. So
if it's a motor vehicle collision, 100% they have probably some orthopedic injury.
Yeah.
So orthopedic injury would be a fracture of the extremities of some sort.
Or even falls. A lot of our patients who are even simple falls will have clavicle injuries or will have a broken wrist or like something else that, is also being looked at by other specialists as well.
Yeah.
Yeah. Well,
so if you just took the standard person off the street and they'd say, okay, you're Dr. Martin, you have a very successful cosmetic surgery practice, you go in at 9, you dress nice, and you see people casually, and you know all your patients and they're loyal to you, and everything's controlled. The surgeries, I select who I operate on. If I don't want to operate on them, I don't think they're a candidate, I say no, right? I have an amazing office manager. I don't know, what's her name, Nils? Amy, that's right.
An amazing Amy.
Yeah, an amazing Amy. And, I have a staff that's amazing. And we have pretty much protocols for everything we do. There's literally no surprises.
Oh, there's surprises.
I mean, you know what I'm saying. Surprises. And to go from that comfort, almost like that womb, and then to go into this where everything's so unknown, a lot of people, if you just ask them in their lives, would they do that? And that would be no. And the reason that I do that is that I like to challenge myself. That's the person I am. That's who I am. And I think that makes me a better surgeon. At the same time, I can understand why someone would say, this is crazy. And I could also understand if being a patient of Dr. Martin's, they call and they say, Dr. Martin, Mr. Cosmetic Surgeon, is actually in the ER, reconstructing someone's face.
Mm-hmm.
They could be like, what is going on?
Yeah. The times, there are times when you have to leave clinic, when something is very urgent, then we're tasked with having a half a day or a day's worth of patients that we have to move immediately. That's always...
I think we should just go with the story that I do have emergency Botox in the ER.
That's what it is.
Just stick with it.
Yeah. Well, we do try
and we should Instagram pictures of me in the ER with Botox and very sick patients.
Right, yeah. This is an emergency.
Yeah.
No, we do try and warn people also when we're booking them during the week of trauma call, just as an FYI, Dr. Martin is on trauma call this week, so if you get a call from us and we have to move you.
I do think, though, if you look at a level 1, which means like a high level, the most critical kind of ER you would go to if you were seriously injured, if you look at those, it's pretty amazing how much energy is in those places. Mm-hmm. And then you can see when you're there, you can actually see why people actually work there.
Right. Well, and why people who do ER get almost addicted to it.
100%.
They can't go into general medicine.
And let me tell you, they work their asses off, and it's like 12-hour shifts. Yeah. And, in one bay, they have the person with a gunshot wound to their face. The next bay, they have a heart attack. The other one, they have a stab wound to the belly. And then
some woman in labor has just been rolled in.
Right. And some strange infection. And every one of these people are critical. Some of them are almost dying. Every day they deal with that. So listen, shout out to the nurses, the first responders, like all the ambulance drivers, the firemen, the ER doctors, the ancillary staff.
The
shout out to them. Because I do it 4 weeks a year, and I walk in on my red carpet, just walk in there, do my work, and get out. They're there every day. Mm-hmm. It's some real work.
It's not like that. Like you kind of touched on, the emotional side of things too. We certainly have had a fair share of patients who have been assaulted. You mentioned gunshots. We've had gunshots that were not self-inflicted to the head. What kind of?
We've had a lot of those.
We have that it's not just the energy of the work, but it's also kind of having that mental capacity to take on all that emotion. and not let it destroy you.
Yeah, I dealt with that when I was training at Cook County Hospital. So I did plastic surgery at Rush. Rush is right next to Cook County Hospital. Cook County Hospital is one of the most well-known hospitals in the United States. And they have one of the biggest trauma units in the United States. If anyone's old enough to remember the show ER, it was based on Cook County Hospital.
Isn't ER still on? I don't have cable. Is it still on?
Why do you ask Nils? You think Nils is watching?
I don't know. I always just assume that everyone else knows pop culture except me.
Okay. Yeah, because you can't get it at a library. It's not in a book.
Oh, I'm pretty sure they probably have back seasons
So
of ER at the
embarrassing.
library.
You're so reedy all the time.
Reedy.
So when you were there, it would be this even worse. And everyone knows what's going on in Chicago. That was going on back in the early 2000s, late 1990s. Massive amounts of young males getting shot with high-powered guns, and every day you would just have this incessant line of people coming in just dying. And it gets to you after a while. It affects you mentally. And I think it helped me personally, like from a surgical standpoint, that it made me harder and stronger. But I think from a life standpoint that took a part of me that will never come back.
Right.
And I think that when you work in an ER, you're an ER physician, nurse, ancillary staff, part of your life gets taken away. But then the other part that gets replaced is the fact that for every 3 people that you may not save, you save somebody. And that is so addictive. I mean, I don't want to talk about like what it gets to you, but it is kind of addictive that you can take someone with a gunshot wound to their face and reconstruct their face, and then like 6 months later, you couldn't even tell. And I've had a patient like that. We still talk to that family.
Yep.
I mean, they text me randomly and just say, hey, just give me an update how he's doing. And there's no bigger gift in life to take a talent that you have, that you know that you're good at, and to take it to an extreme situation where someone's suffering beyond all suffering, and that you can bring it back. And I know that's self-centered.
Well, no, but you get to see, and we get to see the end result, and I think that would be super challenging for, like, let's say an EMT. I mean, all you ever see is the trauma part. You drop them off in the ER, and like you have no idea what happens to that person.
That's why I like these firemen and these ambulance drivers and
I don't know
stuff.
how they do it.
I don't know how they do it.
No, because they could immediately turn around
they
and go
literally
somebody else.
are out in the field just like
Yes.
like the person's basically dead when they get there, and they're just pumping them with drugs and doing like resuscitation, hoping that they can keep them alive till they get there, and they have no idea what happens. Now I'm sure they can go back and say, hey, did that guy or lady make it? But every night.
Yeah, that's just
And then they get the call like the person's stuck,
Right.
What does that feel like? Like you just stuck a needle in someone's heart to keep them alive, and the next call you had was some lady lady or man got stuck and they can't move.
Right. Fell in and they can't get up.
I guess after a while you're like, whatever.
Right,
That's the job.
Right, next patient. Yeah, like, okay, let's go get that cat out of the tree.
I would have a hard time switching back.
It would be hard,
Do you
right?
need a needle in your heart, lady? No.
I'm going to do a trach.
All right, this has gone off the...
It has, but I think...
That's okay. You have to look on our YouTube channel, Jason Martin, MD. Sarah did our slides. She does an amazing job. And she's talking about the craziest cases. That's the slides. And the man's arm is his leg. The leg is the arm. And I don't even know what's going on
Arm
with
is
the
a head.
Yeah.
Head is an arm. It's a real messed up picture. If you want to see it, definitely check out our
It's kind of
YouTube
trippy.
channel. But the point of this is the craziest cases. And universally, when I ask people what they want to hear about on our podcast, they always say, like, what's the craziest thing you've ever seen?
We can make this podcast way more popular if we just talked about crazy cases the whole time.
We could talk. I mean, we've been working together for
Literally.
11 years.
Literally, we could, number one, have a whole year of podcasts on crazy cases. And we would have a huge following because people love stories about medicine, surgery, especially weird ones. Now, I think that's a little bit salacious, and we like to be more educational. Boring Amy, boring Dr. Martin, but that's okay. This episode will give you some crazy cases.
Crazy
We're
trauma
gonna give you a little
cases.
sprinkle of crazy.
Yep, some crazy trauma cases.
Not
So-
crazy people. Well, some of them are crazy, but that's okay.
Yeah,
Yeah.
everyone's crazy.
All right, you go first. What do you think?
Oh, for me, the craziest one, and this is an interesting story. This was a gunshot wound to the head. This man was...
We don't give too many specifics because there is something called HIPAA
HIPAA.
and privacy, so we're going to change a couple things, but
Yeah.
Amy understands that.
Yeah, the details are, the patient is not as interesting as the story.
The story, yeah.
Yeah,
exactly.
so this person was shot in he was inside a vehicle, was shot in a parking lot. It was not the intended victim as far as anyone could tell. But it was crazy because the bullet came through the window of the car and went through his eye socket and lodged in the front part of his brain.
Oh, I totally forgot this. I forgot this one.
He was okay.
He was totally okay.
We ended up not doing surgery on him at all. So the neurosurgeon went in and took out as much of the bullet as they could get, but they were concerned about fragments that had gone through it didn't even hit his orbit, like went through the bone, but missed his the globe of his eye, missed his eyeball.
So you can imagine your eye, if you're listening to this, and then your nose, the space between there, that's where the bullet went.
And lodged in his brain. So he came in to see us after he'd been discharged. And, like I said, we had not done surgery on him. It was just to follow up and see if there was any need to do anything to that bone that kind of is around your eye that it went through.
To kind of make sure his eye was okay.
Yeah. And my front desk person at the time was super sweet. And she got out and given him and his wife the paperwork. And, we saw him and he left. And she goes, was it just me or was there something a little off with him? And I said to her, I'm like, he was the guy that was shot in the head. She's like, are you serious? Because
he was a little off, but he got shot in the head.
Exactly.
And 2 weeks later, he walked in our office.
Yes.
I'm cool with that, right?
Yes.
I'll take a little bit off.
Yeah. So we referred him out to an eye specialist for any floaters that he might have, but he never ended up needing surgery with us.
Nope. And I thought I would need to do surgery on that. That was a crazy case.
Craziest thing ever.
That was a nutty case. The one that first comes to my mind, and we know this patient, and she's awesome, but a patient who was in a car wreck and sitting in the back seat. I don't think she was seatbelted, but she could have been. And the driver lost control of the car. It swerved off the road, and a fence post actually went through the windshield, went through the front part of the car, and into the back part of the car, and basically dislodged half her face. Mm-hmm. Her entire half of the face is dislodged and thrown back behind her ear, down to her skull base. So that means skin, fat, bones, nerves.
Eye, the globe of the
her
eye.
Entire eye, everything.
Part of her nose.
And that alone is crazy. But then the phone call I got from the ER doctor, I've never experienced this. He couldn't even describe it.
Yeah.
And he was almost borderline emotional. And I was sitting there in the middle of the night. I was like, what is going on? Am I dreaming this? Dude, just tell me what's going on. Why are we talking around this problem here? Usually they'll call, they'll say, 30-year-old male is bilateral orbital fractures, 30-year-old male, self-inflicted gunshot wound to the face with injuries to the mandible, nose, and frontal bone. They would just describe the injuries and, hey, tell us what you need us to do. Can you see this person? But he was at a loss of words. So I went in to see this patient, totally awake, with half their face gone, talking coherently and saying, basically I realize this is bad. Am I going to be okay? It was that was crazy. And
can I interject a
sure.
little bit crazier part of just to add to this before you get too far into it? So that same morning, I was headed up to Aspen to our clinic there. So it was very early in the morning. It was before 5 o'clock in the morning. And you were scheduled to do a cosmetic surgery that day starting at 7 o'clock. And you called me, which I thought was weird because it was 4:30 in the morning. And you basically just kind of recapped what you said to me. We've got a trauma call. I said, well, what is it? And you were kind of trying to describe it to me, hit with a fence post. You said, kind of the same thing, that everything was gone. You weren't sure what was going to happen, but you wouldn't be able to start surgery. So it's 5 o'clock in the morning, but this patient was on her way to do her cosmetic case with us. They were about an hour away from Denver. So I knew that they were probably awake and driving as well. So then I call her and say, Dr. Burns on trauma call. He got called in. This case, I don't know how long he's going to be in, but, maybe don't start driving just yet. So continue.
Oh, yeah. Did you describe it like I did, where the post took out half her face?
No,
Okay.
I just said that you'd been called in.
Because that would be really concerning if you're doing an elective cosmetic procedure.
At 4 o'clock in the morning, right?
Yeah.
No, I just said, don't start driving just yet. I'll call you as soon as I know more.
Yeah. Man, that was a crazy case. And that I operated for 8 hours straight on that.
The picture, I think what was challenging too was the pictures of that, because you took preoperative pictures, of course, like we do with any patient, and there was just nothing there.
There was nothing.
The jaw, remember the jaw, the
her
whole
jawbone,
angle of the jaw
everything
was gone.
Everything was
the
back
ear.
Behind her ear. It had all been displaced. Unbelievable.
Yeah, you had a little piece of tubing that you had stuck in the ear canal.
Just to see where that was.
Yep, to make sure it was there. The whole angle of the jaw was gone. And I remember it was still even you describing it to me, I kind of understand why the ER doctor had trouble, because it was there was so much.
So fast forward on this patient. So we had tons of surgeries on her. One big surgery at first that I did We got different specialties in people that I work with.
Well, and obviously she had other
oculoplastics, OMF,
injuries,
oromaxillofacial. It was really interesting. So she lost her eye. Her eye was non-viable. Everything was gone. So they built a prosthesis for her, and the prosthesis was not a globe or a fake eye. Who had a fake? Like Sammy Davis Jr. had a fake eye.
It was not like a glass
Dick
eye.
Vitale has a glass eye. Yeah, glass eye, because there was nothing around it. Like
the socket was what was gone.
Everything was gone.
Yeah.
So she lost her soft tissue, like the eyelids. Everything was gone. That's not something you can really reconstruct. And what we did is we went in secondarily, implanted metal magnetized posts around what was left of the orbit. And they built this prosthesis, basically from someone who works on movies, same kind of person, that
hand paints it,
mimicked her other eye,
yeah.
And it had the texture of skin, and it had magnets on the back of that, and she would take this and just put it right.
Yep.
And she applied like a little bit of makeup around it, and to be honest with you, with glasses on, you probably wouldn't have told.
No, it was remarkable. Yep.
So she ended up wearing a patch because she didn't like the prosthetic that you would put on there, but it's a pretty cool procedure to go in there and do that. And it was neat to see them mimic the other eye with this kind of prosthesis they made by hand.
Yeah, incredible specialty. I mean, that case really shows just how amazing the human body is, and
if you saw her in the street, you'd never know.
You'd never know. Especially, I mean, even with her patch on, you'd be like, oh, she lost her eye.
She lost her eye, but
right.
her other face looks, the side of her mouth works okay. I mean, some of her nerves came back there, thank God, but yeah, you wouldn't know. You really wouldn't know.
She can talk just fine. I mean, she wore her hair over the the missing ear because that was never kind of.
Yeah, I mean, there was some of the ear was left, but not the full ear.
Yeah, that was remarkable case.
All right, what other crazy case you got?
Ooh, I gotta think of a good one that's not just really tragic. Oh
yeah.
Oh my goodness.
They're all tragic.
They're all tragic, but well, they're not all tragic.
Yeah.
Like sometimes people just do stupid stuff and end up in the ER.
100%.
So don't start feeling like.
By the way, the drunk stories are great. There was one guy who fractured his face, and real bad fracture, and he said, "Yeah, I got jumped." This was his whole story he was telling me. He's like, "I got assaulted. Basically, these guys jumped out and they beat my ass, and then like 2 days later, one of the lower level residents pulled me aside. He goes, "They finally got the security tape." The guy took his motorcycle and just rode it right into a wall because when he was drunk,
crashed his own bike.
So the wall assaulted him.
Yeah, he was assaulted by a brick wall.
I thought that was pretty good.
Yeah, I think one of the other really super cool ones that stands out just because it was kind of like so crazy. So this guy was out. It was out of state, and this is the thing. Denver is kind of the largest metropolitan area in a wide range of states. We border up against Kansas and Nebraska and Wyoming.
So everything gets flown in here.
They get flown in. If something's really bad, it gets flown in here. So this guy was from Kansas, maybe?
Yeah.
He was...
This is a crazy story.
Yeah, driving his pickup truck, hauling a trailer, and somehow the trailer flipped, pinned him under it.
No, so he's driving, and what's it called when the trailer does...
Jackknives.
It jackknives, but then the trailer rotates, hits the ground, and flips up and goes over on top of his truck. And it's a huge trailer. Like, it's not a trailer you see in the Midwest. It's like a Kansas trailer with stuff on it.
Yeah,
and I want to say there was a tractor on it. Something was on it.
I think there was. There was either another truck or a tractor on it.
Something big.
Something heavy. It was not hay. It was not full of soft, fluffy hay.
And this guy is severely, severely messed up. Sorry, go ahead.
Well, no, that's... Yeah, so he was pinned for hours, though, because he was on a rural road. And, no one knew this had happened to him. It was a single vehicle incident. I mean, it was his vehicle attacking him, basically, like the wall. So by the time they got to him, I mean, he'd been pinned there for hours.
Yeah, I don't know, a long time.
Hours. I mean, like a long time. Like, dude, like when he came in, he's like, he thought that he was going to die there. Like that no one would find him and he would die there.
Yeah, normal guy, 30s.
Young, has
married,
a wife.
has young kids and... farmer type, super nice.
Yeah. So
and he's like, I'm dead.
So however it happened, they flew him to Denver.
So they got him out. Jaws of life, big deal. It was like took hours to get him out. Flew him to Denver. So this is the best part. So I'm on trauma call, Obviously, that's what this episode is. And I get the call. And so, by the way, when you're at these major institutions, they always have training doctors there, which are great.
Actually kind of awesome.
Yeah. Kudos to those kids, men and women. They do really hard work. They're also kind of like dumb sometimes, so the way they describe things to me are wrong, but that's okay. I love you still. They do really hard work, and I used to be there. So this resident calls me and says, hey, we got this fly-in from Kansas. Guy pinned something. He's got something, a little thing with his ear.
Small laceration.
In his ear.
That's what they told us, yeah. He has an ear laceration.
So I was like, well, I don't need to fix. You guys, no. He's like, it's a little more complex. I think you'll need to fix it. And I'm like, okay. So I was like, can I just come in a couple hours? Yeah, a couple hours.
Because we were in clinic when they called. Yeah,
that's right. That's right. I went over after clinic.
And I'm like, it's an ear laceration. I'm like, how bad could it be?
This guy's whole ear is gone.
Well,
and I literally asked the kid. I was like, where is his ear? Where's his ear? And he goes, well, it's back here. He points to the back of his head. And I was like, bro, when you called me, you said this was a minor ear laceration. I mean, I reconstructed that. I'm not joking. That guy, and he had other facial stuff and some things going on, and mostly in the scalp, so he was very fortunate.
Yeah, it was it was like scalp rotation.
He came in 4 weeks later, and I didn't know who it was.
Because he came in for his staples out when you were gone.
Right.
So I took his staples out 10 days later.
He walked in with his wife, Kansas, cowboy boots.
Look, he has a little sling on his arm.
Yeah. And I was like, who are you here to see?
You thought it was his wife. You thought his wife was the patient.
And he's like, well, I'm here to see you, Dr. Martin. You fixed my ear. I go, I fixed your ear? He goes, yeah, my ear. I go,
your whole scalp.
I know you. I didn't just fix your ear. I just rebuilt your ear.
Yeah.
So that was a crazy case.
His ear and his scalp. I mean, it was like you rotated his entire flap.
It was like you took half your skin and soft tissue, not the bones, off, and just flapped it back, and it was behind your head where your neck is.
Bringing all that back.
And that's where the ear was. And I swear, every time I see that resident at the hospital, I'm like, dude, you got to improve the way you describe things clinically, because your description of degree of injury is way off. I hate to see what a bad injury looks like. There's no head left, okay?
Although, that might be kind of good if you're a patient.
Yeah.
The resident comes in, he's like, oh, this is nothing. It's just like a small cut.
Right. Meanwhile, there's nothing left.
Right.
So that was a good one. We talked about this one before, the gunshot wound to the patient who was self-inflicted, and that was a major injury. It was an injury to the mandible or jawbone, to the tongue, to all the teeth, to the hard palate or the area above your tongue, to the nose, to the septum of the nose, which is the temple of the nose, to the frontal bone, into the brain. And I was able to reconstruct everything. He had to have neurosurgery, right? So he had to have brain surgery, and he was affected, for the rest of his life from that. He was not the same, but he was able to recover, look somewhat normal, and have some quality of life, which is amazing.
Yeah, no, he looked fine when all was said and done, but his functioning was definitely decreased.
Because of the injury to his brain. But that was rewarding in the fact that you could take something so bleak and bring it back, and that's the one I was referring to, that the patient's family still is in contact with me, and they give me personal texts. Once every 6 months, just give me an update. It's really touching.
Yeah.
We had one recently. We just saw her. Who, not every injury is so traumatic, like a tractor falling on your head or riding your motorcycle into a wall.
Yeah. Or the back of a moving vehicle.
Yeah. Oh, God, we've had all those. But this is a lady just got up and was trying to go downstairs, new house, got lightheaded, which happens a lot, especially in older people, but younger people too, and fell down a full flight of stairs and basically fractured her face so bad that all the facial bones in her face were fractured, that her face was movable, meaning that there was nothing holding her face in place, that I could physically take her teeth and move it frontwards and backwards, and the whole face would move. So she had a pan-facial fracture. Every bone was fractured. Severe injury, severe head injury, severe brain injury.
Yeah, she had bad concussion.
Severe orthopedic injuries or extremity injuries. And, I said to the family, I was like, this is, I don't know how this is going to turn out, just because of the severity of the injury. She was older, even though she was healthy. And it was, I don't know, how long was that surgery? 9 hours?
Oh, at least.
And we tag team a lot of a lot of surgeries. So we'll bring the oculoplastics, myself, oral maxillofacial. she actually turned out, I mean, we saw her the other day. Now, again, her brain functioning is a little bit off, but if you saw her, you would never, ever know.
Nope. She went from, wheelchair, walker, now she's got a cane.
She doesn't remember any of it.
Which
and
is
she's
good.
Like, she's like, this is frustrating to me. Everyone talks about how lucky I am, and I don't feel like I'm lucky because I don't remember anything. Right. I remember the night before, that's what she said. So, yeah, that was a crazy case. Just the severity of the injury from a fall. You could see that like in a severe car crash or falling out of an airplane or falling off a building, and that happens all the time. Cliffs, buildings, you name it, people fall and they live. Sometimes, unfortunately for them. Yeah. But this was just a flight of stairs. She just had the perfect hit.
Well, that's another one that was kind of a combination of perfect hit and an ER that did not fully explain the severity of an injury. It was late. It was like late winter. So in Colorado, they use a chemical on the roads that basically de-ices things, but kind of makes this disgusting mud mix everywhere. So this
what
woman,
is that stuff?
Magnesium chloride.
Oh, yeah. Because we can't hurt the birds in Denver, and
salt's bad. Mag kills everything. So
I mean, it gets on all your. I mean, you don't. If you haven't been around mag chloride, you don't know. I mean, like you'll in the wintertime here, you'll go wash your car because it's so full of mag chloride. And then you go out again, and then it gets full of mag chloride again. It's like not even worth washing your car.
Yeah, and
when it snows, and it snows a lot.
And they mix it. They cut it with what they call ice slicers. So they cut it with like a sand salt mix. So it's this combination of this chemical that cuts through stuff, and then this sand salt mix that just creates like a sludge, a slushy sludge. So this woman and her husband were at a car show in like a big garage. Well, the floors were all wet because everyone had brought their cars in. They'd all melted off this disgusting mix of ice slicer and mag chloride all over the place, and she slipped and fell. And so she slipped and fell and hit. She had a cut like right above her eyebrow, essentially. ER calls. It was late, like after getting close to being after dark. It was winter. But Dr. Martin and I were still here, and it's like just send her over. We'll just do it here. So like just discharge her and send her over because the ER doctor said it was tiny, little, nothing. They did a CT scan, everything's fine. So she comes in, and Dr. Martin had to be on a conference call, so I'm kind of in there. They'd numbed it, which was great, so I could kind of get in there and like clean it out. And I was irrigating. It was just some sterile saline, and I'm like, that's her bone. So I go and Dr. Martin's on the phone. I'm like, you gotta get off. like, because I'm looking straight through the muscle. I'm like, she's got bone fragments in here, She
totally did. That CT scan was wrong.
Yeah.
Or that guy didn't look at it.
Before I get in there and start scrubbing stuff, you want to come take a look at this. Yeah. So, that was, and she was fine. Obviously we sutured it up and it was fine, but it meant a little more involved repair of like her entire muscle, not just a simple skin. Yeah. Yeah. They're like, 3 centimeters, just skin.
And so that's actually something like when you reconstruct these people, you have to do every layer, the muscle layer, the fat layer, the skin layer, the bones. And that's why it's good to have someone like me or someone who has an expertise in this stuff, because that anatomy, you know what it's supposed to look like, especially someone who does a lot of cosmetic surgery, what the end result should be. So it's a benefit. Yeah,
like where stuff should be.
I feel like we could have a full year of podcast.
We could. Yeah.
We'd probably be the most successful podcast around.
Oh my gosh, can you imagine if we were able to have like pictures of CT scans and stuff out here?
Oh, that would love it.
Because we have had some crazy CT scans over the years.
Just change the name, like some of the demographics, so that you wouldn't violate any problems and just go to town.
Right.
Some of the crazy stories that we're not even telling are the inebriated drug stories of things that occur, and you're like, I don't even understand the story. It's so crazy.
Fights and
dogs
awful, really sad. Yeah, dog bites. All the things you can imagine. And we are.
When I was at Cook County, I've said this before. Did I talk about this in the About Me podcast, the one you surprised me with?
Which one?
Oh, when they had the prison riot.
Yes, you did. The guy who was shot in the butt. Yes.
Yeah. And the guy next to him had been stabbed 28 times. And the guy next to him that stabbed 28 times was just sitting there like, get me back to jail because he's going to go kill a lot of people. And the guy who got shot in the butt was like, I'm dying.
It was a superficial gunshot.
It was literally the shot went through one butt cheek and out the other. It didn't hit anything important. It just hit meat.
Yeah, soft tissue only.
Soft tissue.
Yeah.
Yeah, that was funny.
No, so you guys should absolutely, if you have not listened to that episode, it's where I interview Dr. Martin and he talks about his training.
And I did not willingly do that. She
No,
surprised me.
I surprised him.
I'm a narcissist,
I
but not that
surprised
much
him
of a narcissist.
when we were on trauma call because you were all you were all exhausted and had no idea.
If you actually watch that video, it's terrible. I come in with a Henley on. It looked like someone slapped me in the face.
Well, you were on trauma call.
Yeah, that's the way it goes.
So
I'm on trauma call right now. I got a suit on.
I know, but you were prepared this time.
All right.
We're up in our game.
All right. Well, you got to look at our YouTube channel. We have some really good stuff from previous episodes, and I think that one's up there. It should be.
Yeah. So
All right.
if you enjoyed this podcast, please give us a like, rate us, review us, share us with your friends. It really does help. And
why don't you send us a crazy story?
Right? Send us your crazy trauma story. We would love to hear what
We're
you
gonna
guys
have a
would like to
podcast
hear
called
more of.
Crazy Medical Stories.
Right, where we read people's. There's YouTube channels where they do that. Like,
just read it.
No. This OBGYN will like review those things. Like, she'll be watching an episode of like, I didn't know I was pregnant, and like commenting on how.
We should do that. Just watch episodes of TV and just say this person for sure had a facelift or for sure didn't.
Right.
Yeah.
Well, we can just watch episodes of like Grey's Anatomy and we can cringe at all the horrible things they do.
True.
So
okay.
but
Sorry to interrupt.
like us, rate us, review us. Be sure to follow us on YouTube. We are at Jason Martin MD. We're also on Instagram at Beauty and the Surgeon Podcast. So we would love to hear from you. Tell us what you'd like to hear more of, and we'll do more of that.
And if you have a Botox emergency, go to the ER first.
Right. Explain your emergency.
Request Dr. Martin when I'm on trauma call.
Thanks, everyone.